Hi, good evening everyone. Today is the day 30 of the Gear Up Mains Answer Writing. We completed the day 30 today. In this week, we are discussing about the question of social justice. Those who are new here, according to them, we are doing previous year question in this program. And these questions are specifically focused on how you will write the answer. What is the main core demand? How you can divide the question into multiple parts and you can address each part of the question. How you can then add a case study, how you can write an example, what should be the introduction, what can be the conclusion. We are also providing you the question in the morning in the Telegram group. You can join the Telegram group for the Gear Up for the Mains 2023. This is the same name, Gear Up for the Mains 2023. You can join this Telegram group and you can write the answer. Okay, so today is the day 30. Let's see the question. What is the question? Today's question is, appropriate local community level health care intervention is a prerequisite to achieve health for all in India. Means the community level health care intervention, strong community level health care is a requirement for achieving the health for all target in India. Means health for all target, health for all by focusing on the community level health care. So we need to be write our answer focused on community level health care. So we can write the three parts here: introduction, body, and conclusion. In body, we will write the three things. One is the importance of the community level health care. What is the importance? What is the challenges? And what can be the suggestion for improvement of the healthcare system, specifically the community healthcare system? So this is the requirement of the questions. The question is completely focused on the community level healthcare. What is the status of the community level healthcare in the country, and how a strong community level healthcare help in achieving the health for all in India. Explain. Okay. In the introduction, what we can write? During the COVID time, we see our health care system was crippled. People was going here and there for admission in the hospitals for the patient. They are not finding the enough bed. In the village level, the situation was more worse. Even in the metro cities, there was the lack of the beds of the hospital. Lack of availability of the facility in the community level primary health care, secondary health care system. So there was an issue with the community level health care. So we can write, or we can start with this situation of the COVID-19, with the recent incidents of the community level health care. So we can write this about the COVID-19 in the introduction and the healthcare, community level healthcare specifically. Then we should also write about the community level healthcare types. They are a sub-center of the community level in the village level, sub-centers of the healthcare system. Then the primary healthcare, system, and then the community level healthcare system. This is the hierarchy of the healthcare system in India at the village level, at the tier 2 level. Sub-center, primary healthcare, then the community healthcare. In the introduction, can we write Sustainable Development Goal 3 in the introduction? Sustainable Development Goal 3 is the health for all, but we need to be focused here on the community level healthcare, specifically in the country. You can lately write about the SDG in the conclusion, but in the introduction, you need to be write specifically about the community level healthcare and the healthcare system of India. So we will give a point of the COVID-19 where we see the shortage of the healthcare system and specifically the unpresence of the community level healthcare, the primary healthcare system in the village level, at the community level, at the primary level. If primary healthcare, community healthcare presents, then there is a shortage of the doctors, shortage of the nursing staff, shortage of the beds. So we can write this in the introduction. In the body part, we are dividing the question into 3. The first part, we will write about the community level healthcare, advantage or importance. Importance of community level healthcare system. Second, we will write the challenges in India. Challenges of community level healthcare in India, and then we will suggest some of the way how it can be improved. Also, we will add some of the government initiative related to it. Government initiatives. We will also add the government initiatives. So this is the overall question demand about the health for all and the community level healthcare in the country. Now let's come to the first part, importance of the community level healthcare. What is the importance of community levels of healthcare in the country? First is the first point of contact. We are living in the villages, we are living in a tier 1, tier 2, tier 3. We can easily approach to the primary healthcare center. We can easily approach to the sub-center and the community healthcare center. So this is the first point of contact of any of the person who is living in the nearby area. So he or she can easily go to the primary healthcare center, or this is the first point of the contact, like the Delhi Mohalla Clinic. They are the first point of the contact with the nearby area. So these are primary healthcare centers. Second point is the early detection. If the healthcare clinic is near to me, it is easily accessible to me, it will help me to diagnose my disease as early as possible. So they are helping in the early detection of a disease. If there is a good community healthcare system, good primary healthcare system, they are having the good equipments, number of doctors is present there, no absenteeism of doctors, availability of the nurse, availability of beds. These are all factors which should be included into the community healthcare. Then the accessibility, how far it is from my house. Without any transportation, I can access these healthcare system. The timing of the accessibility, easily approachable, good doctors. So it can be the easily accessible to me. Capacity building, presence of the infrastructure, good infrastructure, presence of the machinery, presence of the well qualified doctor, help in the capacity buildings. If they are the primary healthcare centers, if they are the community centers, they should be affordable. So that everybody can afford these centers. It should not be like they are charging very high cost. So they should be affordable for the people living in the nearby area. So the affordability is also a component of the community level healthcare system in the country. Next point is the primary drivers of the healthcare awareness. This is a very important point. If we want to deliver any of the information related to the health, if we want to deliver any of the information of the health scheme run by the central or the state governments, these primary healthcare, these community healthcares are the first point, where they can easily deliver the information to the target population. And promoting the cooperatives. So we can also develop the healthcare system by promoting the cooperatives. So this is the importance of the community level healthcare system. So you should write this first in the body part about the importance of the community level healthcare in the country. So this will help in achieving the health for all goal or the sustainable development goal 3, okay, health for all. Now come to the next part. What is the challenges in India related to the healthcare system, specifically related to the community level healthcare system, primary level healthcare system? Lack in numbers. The numbers of these primary healthcare centers, sub-centers, community health centers are very less in the country. Even they are not present in some of the area, in the hilly region of the country. In the villages they are not present. So there are the lack in numbers of the community level healthcare system in the country. Infrastructure deficit. If some of the states, in some of the city in the country, if these community level healthcare are present, the infrastructure is not good. There is not good maintenance of the infrastructure as well. Lack of machinery, lack of the other equipments required for the primary health cares, no proper room, no proper sanitary. So infrastructure deficits is also the challenge of the primary health care, the community healthcare system in the country. Lack of services provided by the primary healthcare centers at the ground level. They are not providing the every service at the ground level. Lack of doctors. Lack of resources means lack of doctors, lack of nurses, lack of tablets, lack of bed. According to the WHO, there is only 8 beds per 10,000 people in the country. See, only 8 beds are available for the 10,000 population in the country. So this is the very lack of infrastructure. Where in some of the developed countries we see the China and the South Korea, the number is 30, 40 and 50. So this is lack of the services and the lack of the resources under the primary health care. Unskilled and the overburdened staff. The number of the nurses required for the 1,000 per 1,000 population is very less in the country. Only the 1.3 nurses approximately per 1,000 of the population in the country. So this is the condition of the healthcare system. Shortage of the health personnel. The number of doctors suggested by the WHO is very less in the country. We are only having like the 3 nurses per 1,000 is suggested by the WHO, but 1.3 nurses per 1,000 in India. These numbers also specifically for a doctor also. Inadequate funding by the central governments. The central governments and the state governments are not focusing on these system. The fundings provided by these governments are not enough to run these primary healthcare centers at the village and at the primary level. Complex healthcare system of India for majorly focus on the private health system. If you see, according to a report, a person is spending approximately 67% of their income on the health. I am talking about the poor people who are spending 67% of their income on the health. This leads to 4 to 5% of the population which are going to the poverty, which is going below poverty line. And for the 1.4 billion population, this level of infrastructure is not enough. So you can write these points under the challenges of the primary healthcare, community healthcare in country. So this is the point you need to be include. First we discuss about the importance, then we write about the challenges. You can write one of the parts in the form of schematic also, so you can save your time. Next part is the what is the government initiative? What are the government initiative taken by the government for these primary health care? PM Swasthya Suraksha Yojana, run by the central governments for the specifically creation or delivery wards specifically in the hospitals. PM Jan Arogya Yojana, health insurance. Jan Aushadhi Yojana, Pradhan Mantri Bharatiya Jan Aushadhi Pariyojana, specifically for the pharmacy, Jan Arogya Pharmacy. They provide the very cheap drugs. National Digital Health Mission means we will have data for the each patient in digital form. One health concept by the central governments. So these are some of the initiatives taken by the central governments for achieving the community health care, to achieving the health for all, and these are the programs run by the central governments and implemented by the state governments in the all states of the country. Now we need to be focused on what we can suggest for the improvement in the healthcare system. What can be the way forward? Increase in the penetration means increase in the numbers of the primary healthcare sub-centers, community healthcare centers. Affordability, the healthcare system should be affordable. As we discussed earlier, the 67% of the income of the poor people are going for the maintenance of their health. They are spending on their health and they are moving into the poverty line. Sustainable infrastructure design, the design of the primary healthcare centers, community healthcare centers should be sustainable. So they can easily afford, easily run, and easily availability of the test, laboratory test, availability of the doctors can be there. Increase in the fundings, central government is only spending 1.6% to 1.8% of the GDP. The central government is only spending 1.6% to 1.8% of the GDP on the healthcare system, whereas the target is to spend 3 to 3.5%. So we are only spending the half of the amounts, and this amount is not spending carefully where it's required. Governance reforms, the governance reforms specifically to the infrastructure level. Empower Anganwadi workers, yes, in some of the schemes of the government, if you see, related to the immunization of the children, the mission in the Dhanush, Anganwadi workers are playing a very great role for the immunization of the children. Yes, this can also be included. Governance reforms, specifically as the implementation of the schemes, running of the primary healthcare centers, a proper structure design, a proper citizen charter is required. Increase in the workforce, like we discussed, the less number of the doctors, the lack of the nurses, the lack of the beds in the country. As we see during the COVID time, so there is an increase in the workforce of doctors, those who are overburdened, increase in the workforce of nurses is also required to maintain the primary health care. Community insurance for the people who are living in that area. So there is a decrease in the spending of the person on the health care, and they can spend on the nutritional products. So it will tackle the malnutrition also. Focus on the disease prevention means India should focus on the preventive health care. Instead of the curative health care, the India should spend on the preventive health care so they can prevent the spread of the disease. So these points you people can write in the answer according to the question. Then you can easily conclude the answer. The primary health care, community health care is the pillar for development of the healthcare infrastructure in the country. In the primary health care, India is not having the good infrastructure. We can learn from the different states' perspective, like the Delhi Mohalla Clinic, you can mention in the conclusion, which are also recognized by some of the developed country. So you can mention this in the conclusion part. So this is done for today. We discuss about the healthcare system. We write about the introduction. We give the reference of the COVID-19 and the shortage of the infrastructure, shortage of the doctors, shortage of nurses at that time, shortage of the bed, our burden of doctors. We can give the reference in the introduction itself. Then we discuss about the importance of the primary healthcare, community healthcare in the country. Then we discuss about what are the challenges related to the primary healthcare and the community healthcare in the country. What are the government programs where the government is working to improve the primary healthcare, to improve the infrastructures, health insurance, availability of the medicine to the local people under the PMBJP. Then the way forward, what we can do for the improvement at the faster pace. We can also write a case study related to the healthcare infrastructure. We can take an example of any of the developed country where the healthcare system is very strong, specifically the primary healthcare. So we can write these points in the answer. We will meet on Monday at same time 6 p.m. with new question. Till then, please revise these 30 classes. We covered almost 30 questions of the PYQ, and the all questions are having the different dimensions. If you are learning these dimensions, it is become very easy for you to write an answer. So please revise these 30 questions, try to write these questions, and you can submit to the Edukemy portal at the master course program. So we will also evaluate these answers. Without writing, if you are just listening this video, it is not enough. You need to write the answer. Please read the question twice, brainstorm, and then try to write the answer and match your answer with the discussion. And rewrite it with the with new points you as you missed during writing the answer. Okay, so we will meet on Monday at 6 p.m. Till now, study well, eat well. Yes, Manoj. Manoj, you can submit the old question as well. You can submit the old question as well to the portal. We will evaluate. No issue in that. Please try to submit it. Okay, so we will meet on Monday again with the new question. Thank you. Thank you very much, everyone.